ultrasound and color Doppler, imaging discoveries. On a grayscale ultrasound, a large right upper ureteral calculus appears as a highly echogenic focus within the ureter, often accompanied by posterior, acoustic shadowing. The presence of moderate right hydronephrosis is noticeable, as dilation of the renal pelvis and calyces, appearing as fluid-filled anechoic regions. In advanced cases, the renal cortex may appear thinned. Due to prolonged pressure, when using color Doppler imaging, a key feature for identifying ureteral calculi is the twinkle artefact sign. This sign is characterized by a rapid alternation of red and blue colors behind the echogenic stone, creating a sparkling effect. The twinkle artefact, caused by the rough surface of the calculus-inducing intrinsic noise, helps distinguish calculi from other hyperechoic structures that do not exhibit this effect. Outlook. The prognosis varies depending on the promptness and effectiveness of treatment. In acute cases, where the obstruction is identified and managed early, the prognosis is generally good, aiming to relieve obstruction and preserve renal function. However, chronic obstruction can lead to significant complications, including kidney damage, infection, and impaired renal function. Untreated chronic hydronephrosis can result in irreversible renal damage. Treatment management involves both medical and interventional approaches. Initially, medical management focuses on pain control with analgesics like NSAIDs or opioids and encouraging hydration through increased oral fluid intake or IV fluids to promote stone passage. Medical expulsive therapy using alpha blockers like tamsulosin can facilitate the passage of ureteral stones. When medical management is insufficient, interventional treatments are considered.
Extracorporeal shockwave lithotripsy
uses shockwaves to break the stone into smaller pieces that can pass naturally. For larger stones or those unresponsive to ESWL, ureteroscopy is a minimally invasive procedure where a scope is used to visualize and remove or fragment the stone. In cases involving very large stones, percutaneous nephrolithotomy, PCNL, may be performed, involving a small incision in the back to access and remove the stone directly. Follow-up is crucial to ensure the stone has passed and the hydronephrosis has resolved. Imaging studies confirm stone clearance and assess kidney condition. Long-term management focuses on preventing recurrence, involving dietary modifications, increased fluid intake, and medications to reduce the risk of stone formation.